Welcome to this clinical walkthrough on the contraception consultation case for UKMLA, brought to you by Mediate, your 24/7 practice partner. So today, we're going to tackle a really common GP scenario, one you're almost guaranteed to see: a patient needing a repeat of her combined pill and also wanting to know how to delay her period. We're going to give you a really solid, repeatable structure to help you absolutely ace this station. We're going to walk through the 5 key stages of this consultation. We'll start with the intro, then dive into the really important safety screening, explore the patient's ideas, build a solid management plan, and wrap up with some robust safety netting. Think of it as a roadmap to get you through any consultation smoothly. Okay, let's kick things off right at the beginning, the introduction. And look, this is more than just saying hello. It's your first chance to show the examiner that you're a safe and methodical doctor. Getting these first few moments right builds that all-important rapport and sets a really professional tone for the whole encounter. Every single Aussie station needs to start with this exact formula. You introduce yourself and you check the patient's identity. It's a non-negotiable step, you know? It immediately shows that you're thorough and you're focused on patient safety. The simple phrasing you see here, it's perfect. Don't overcomplicate it. Right after that, you want to confirm why they're here. This shows you've read the notes and you're on the same page as the patient. It also does something else that's really smart. It sets the agenda. So right from the start, you both know exactly what you need to cover in the time you have. Next up, you need to get a quick history of their current situation. And honestly, a few key questions will get you everything you need. You'll want to know exactly which pill they're on, their routine. Is it 21 days on, 7 days off? And crucially, how are they finding it? Any side effects? Are they actually happy with it? So beyond the what, you really need to understand the why. Don't just hear, "I want to delay my period," and move on. You need to ask about the context. In this scenario, she's traveling. Knowing that, and especially for how long, is absolutely vital for prescribing the right amount and giving her the best advice. All right, let's move on to what is arguably the most critical phase: safety screening. This is where you hunt for any contraindications or red flags. And the best way to do this without missing anything is to use a structured approach, like the PMF-GO-TSA mnemonic. PMF-TOSA is such a brilliant mental checklist. It stands for past medical, medications, allergies, family, travel, obstetric/G, social, and anything else. It's basically your safety net, making sure you don't forget any critical questions. We're about to run through the most important ones for this case right now. When you're screening, you have to start with the biggest risks for the combined pill. Use really direct, unambiguous language, just like this, to ask about any personal history of blood clots or serious heart conditions. These are absolute contraindications, so there's no room for confusion. The next big ones are migraines and cancer. Specifically, you need to ask about migraines with aura. Why? Because the estrogen in the combined pill can increase the risk of an ischemic stroke in these patients. It's a small risk, but a very serious one. And of course, you must screen for hormone-sensitive cancers like breast cancer. And hey, your screening doesn't just stop with the patient. It's vital to ask about their family history. A blood clot in a first-degree relative, especially at a young age, could suggest a genetic tendency to clotting, and that would significantly raise this patient's personal risk. And finally, just round out your history by clarifying a couple of things. Are her periods usually regular? And why is she on the pill? Is it purely to prevent pregnancy? Or does it also help her manage heavy or painful periods? This just adds some really important context before you make a plan. Okay, so once you're confident that your safety screening is done and dusted, you can move into the ICE phase. This is where you switch gears from your clinical checklist and really focus on the patient's perspective, their ideas, concerns, and expectations. A great way to start is just to ask a simple question like, "So what were you hoping we could achieve today?" This helps you get a handle on their expectations. Then you can offer to explain the options. See how that positions you as a helpful guide? It really empowers the patient and builds a ton of trust. Now, don't just wait for the patient to bring up their concerns, because they might not. They might feel a bit hesitant. You have to be proactive. By asking directly, you open up a safe space for them to share any worries they have, which you can then sort out with clear, factual information. And now we get to the heart of it all, the management plan. You've done your homework, you've gathered all the information, and now it's time to put that into a safe, effective clinical plan that actually works for the patient. First things first, address her main request. Let her know that because she's doing well on her pill and you haven't found any red flags, you're happy to issue that repeat prescription. This is huge because it immediately tells her, I've heard you and I'm here to help. Okay, so you've basically got two main options to talk through here. For a patient who is already on the combined pill, the simplest and safest choice is to just run 2 packs back to back. You should also mention the alternative, northisterone, and this is so important, make it crystal clear that it is not a contraceptive, which makes it a less suitable option for her. And this is exactly why it's so important to know the details of the alternative options. You need to be able to briefly explain the side effects of northisterone and, most importantly, state its main contraindication, a history of blood clots. See how that links right back to the fantastic safety screening you did earlier? You know, putting all these pieces together, the screening, addressing her concerns, explaining the options, it really takes practice for it to feel natural and flow well. So if you want to run through this exact scenario and get some objective feedback on how you're doing, you can practice this exact case right now and get objective feedback on mymediate.com. Right, we're on the home stretch now, but this is arguably the most important stage of all, safety netting and closing the consultation. This is where you lock in patient safety and make sure she leaves feeling informed and looked after. Your safety netting has to be explicit. And when I say explicit, I mean crystal clear. You need to list out the red flag symptoms for a potential blood clot, things like a severe headache, sudden chest pain, or a swollen, painful leg, and tell her to get urgent medical help if any of those things happen. And to wrap it all up, always offer a patient information leaflet. Let's be honest, verbal advice can go in one ear and out the other, so having it written down is so helpful. And please, don't forget to give clear advice on what to do about missed pills. It's a super common problem that can really impact how effective the pill is. And there you have it, the complete framework for a really successful contraception consultation. Knowing the steps is one thing, but really mastering the flow and the communication, well, that just comes from practice. The best way to build that confidence is through repetition, and you can practice this exact case now on mymediate.com.